Welcome to Nursing Learners. Psychiatric Nursing. Question 19. Meaningless and incoherent mixture of words and phrases is termed as A. Neologism, B. Verbigeration, C. Word salad, or D. Parallelia. Let's read the question again. Meaningless and incoherent mixture of words and phrases is termed as A. Neologism, B. Verbigeration, C. Word salad, or D. Parallelia. The correct answer is C. Word salad. In word salad, a patient mixes random words or phrases in such a way that the speech becomes completely unintelligible and incoherent. For example, someone might say, "Now later red cat boat ship house girl." It's just a collection of random words put together, with no meaning at all. This is an extreme form of loosening of association. Parallelia is a speech disorder where one sound is replaced with another. For example, a person may say wobbit instead of rabbit, or lello instead of yellow. The other two options will be discussed in the upcoming questions. Question 20. Parrot-like repetition of words spoken by another person is known as A. Neologism, B. Echolalia, C. Echopraxia, or D. Dyscalculia. Let's read the question again. Parrot-like repetition of words spoken by another person is known as A. Neologism, B. Echolalia, C. Echopraxia, or D. Dyscalculia. The correct answer is B. Echolalia. Echolalia is a speech disorder where the person repeats the words spoken by someone else, just like a parrot. For example, if you ask a schizophrenic patient, "How are you?" he may keep repeating, "How are you? How are you? How are you?" like an echo. In echopraxia, the patient copies or mimics the actions of others. For example, if the patient sees someone smoking, he immediately starts mimicking the act of smoking himself. Dyscalculia is a learning disorder where the person fails to understand basic mathematical concepts and cannot perform even simple calculations. For example, they may not be able to solve 2 plus 3 or 10 minus 5. We will discuss option A, neologism, in detail in the upcoming questions. Question 21. Senseless repetition of the same words or phrases over and over again is known as A. Stereotypy, B. Trance, C. Verbigeration, or D. Broadcasting. Let's read the question again. Senseless repetition of the same words or phrases over and over again is known as A. Stereotypy, B. Trance, C. Verbigeration, or D. Broadcasting. The correct answer is C. Verbigeration. Verbigeration is an obsessive and senseless repetition of the same words or phrases over and over again by the patient. The words or phrases may or may not contain any meaning. Example: the patient keeps repeating, time, 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 clock, 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 without any meaning. Stereotypy, trance, and thought broadcasting are not speech disorders and will be explained in some other video. Question 22. The term that is used to describe idiosyncratically formed new words whose derivation cannot be understood easily is A. Mannerism, B. Mutism, C. Negativism, or D. Neologism. Let's read the question again. The term that is used to describe idiosyncratically formed new words whose derivation cannot be understood easily is A. Mannerism, B. Mutism, C. Negativism, or D. Neologism. The correct answer is D. Neologism. Neologism is formation of new words or phrases which cannot be understood by others. These are created to describe the ideas or concepts for which the patient has no dictionary word. Example: a patient says, "I'm feeling very attackedness today." Attackedness is a totally new, invented word and carries no meaning to the listener. Word approximation is a closely related disorder which can be confused with neologism. Word approximation is the use of a normal word in a new way or the formation of new but understandable words. Here, the meaning can be understood even if it is completely bizarre. For example, use of the word food vessel for stomach or easify for simplify. So, neologism is the formation of new words that don't exist, while word approximation is the use of existing words in the wrong way. Mutism is the complete refusal or inability to speak, even though the person's ability to talk is physically intact. Example: a patient remains completely silent despite repeated questions, though there's nothing wrong with their speech organs. The other two options in this question, mannerism and negativism, are not speech disorders in schizophrenia. They belong to a different category of symptoms, and we'll explain them in another video. Some other speech disorders in schizophrenia are clang association, speech based on sound of words, rhyming, not meaning. Example: the train brain rain pain. Perseveration, the persistent repetition of a response or idea, even when it's no longer appropriate. Example: if you ask different questions, the patient keeps giving the same answer. Paraphasia, the patient uses wrong words or sounds in place of the correct ones. Example: saying knife instead of fork. Pressured speech, rapid, continuous speech, difficult to interrupt. The key point here is to learn the major speech disorders in schizophrenia and also understand the differences between them, because these topics are repeatedly asked in exams. The important speech disorders you must remember are neologism, word approximation, echolalia, verbigeration, clang association, perseveration, word salad, paraphasia, paralalia, pressured speech, and mutism. Thanks for watching the video. Please like, share, and subscribe Nursing Learners for more such videos.